In terms of the cases, so we're just seeing New South Wales in the last 24 hours just over 48,000, but over in the US this week there was a record number of cases, 1.35 million in a 24-hour period. Professor, how easily is this virus transmitted?
Very easily indeed. It's probably somewhere near the second most transmissible virus, maybe up there with chickenpox and beyond measles. The interval between contacting someone with COVID due to Omicron and actually getting symptoms has shrunk from 4 days for the old strain, 3 days with Delta, to 2 days on average with Omicron. So it's very rapidly spread. It infects preferentially the nose rather than the lung, but not totally. And so it certainly can develop very high levels of virus within the nose and be very easily spread. The good thing about it is if you're immunized, the amount of virus tends to drop off much more quickly than if you're unimmunized.
Well, we certainly have a high rate of vaccines and a lot of people getting boosters, and of course the first week of children between aged 5 to 11. So we'll see those rates increase as well. Professor, we do hear a lot the word milder compared to perhaps the Delta strain. Do you think the word milder is the best phrase to use?
Yes, I think it is milder, but it's not mild, particularly for the aging. It's quite difficult to get information on age breakdown, but I guess being in a certain age group myself, the figures from South Africa are worrying, given that South Africa is very different to us in that it's had large waves of infection previously and lower vaccination rates. But over the age of 65, if you get into hospital, you've got a 2.5 times greater chance of dying in the last wave over the age of 65 than if you're younger. So if you're older, you're unvaccinated, or you haven't perhaps had the booster, just be very careful about that label of milder. This virus can still cause damage. And I said before, it mainly targets the nose, but it can get down into the lung. And I just remind everybody that it's still true that 67% of people in our ICUs in New South Wales have Omicron. This is not a little flu. It's not benign.
Let's get back to vaccinations. As we mentioned, we're seeing an increase in boosters and a lot of research as well that we're reading in terms of potentially forming another type of vaccine for the Omicron variant. What are you reading?
So fortunately, although the antibodies we developed to the old strain of coronavirus that we're all immunized with at present, they don't work quite as well against Delta and Omicron, and now Omicron, as in previous strains. But if you get high enough levels of immunity, and particularly antibody, it is effective. And that's the reason for recommending that everybody possible gets the booster as quickly as possible. Now, we do know that both Pfizer and Moderna are responding to this, and I presume AstraZeneca as well, and others, by producing boosters that are specific for the Omicron strain. And with these RNA vaccines, you can move very quickly. So the claim is that within 90 days, we will have boosters. So if we need new boosters towards winter, then my guess is that we'll see availability of Omicron boosters. One thing I should say is that there's really no data yet on the protection against severe disease. because we know you need less immunity to protect against severe disease and death, I anticipate that, particularly if you boosted, you will do very well against severe disease. So I'd urge everyone to take up the offer of the boosters and protect yourself against Omicron, particularly against severe disease, also mostly against mild disease, and also reduce the pool of infected people that is resulting in its rapid spread.
And we do have to wrap it up, Professor, but I wanted to quickly ask you, PCR versus the rapid antigen tests. I know a lot of people are waiting for them. They are on their way to Australia, but how effective are the rapid antigens? Because you do have a good point in terms of them detecting the virus in a certain time frame.
Yes, the PCR test is much more sensitive than rapid antigen tests. So to detect whether someone's infected, the PCR test would be preferable if we had enough to go around. The rapid antigen tests are much simpler, quicker, 15 minutes, can be read in your own home if you're well trained. But in terms of correlating with infectiousness, the PCR test is a bit too sensitive. It tends to drag on for several weeks, whereas the antigen test tends to correlate with levels of infectivity. And some of the newer rapid antigen tests are really quite sensitive, and they're quite specific. So that means you don't need to now verify them with a PCR test. So use the rapid antigen tests as the health authorities have suggested when they're available.